Hi everyone. This little video is just to give you all some general feedback on NSN008 Assessment 1, which was the evidence review. Overall, reading the essays, I actually learned a lot. I was really impressed by the expertise that you as a group of clinicians hold. There was some really insightful commentary into the things that we as nurses do to really impact and improve the lives of people living with chronic multimorbidity across a range of settings. So thank you so much for the significant effort that went into researching and writing your assignments. But there's always room for improvement. So this video is just about helping you to improve even further for assessment 2. So starting with the introductions, an introduction on an essay is an opportunity to tell the marker what's in your essay. So what are the things you want the marker to focus on in your essay? So if you simply repeat what's written in the assessment tasks, this is actually a bit of a waste of that 100 words, where you could be telling the marker about your approach or your unique focus rather than what they already know is in the task. The first part of the essay, exploring why chronic health conditions coexist, this was generally done really quite well across the board. Students presented data to support that these different diseases are quite prevalent and that they're often linked, and that often there are social and lifestyle factors underpinning those links. Some students would benefit from carefully revisiting the differences between risk factors and social determinants of health. They're quite different concepts, but they were a little bit blended at times. I definitely appreciate that social determinants of health can be quite a big concept to get your head around. So I recommend that if you're a little bit unsure on this, you read the article by Northwood in Module 1. It's article reading number 1.5, if you have not yet done that. The one before it is also good as well. The second part of the essay, the critical analysis of nursing interventions, there was a really interesting and diverse range of different interventions discussed across the board. And students that did really well in this section did a number of things. The first thing was that they identified nursing interventions and were clearly able to explain the role of nurses in delivering that intervention, and therefore justify why they were nursing interventions as opposed to standard monitoring and treatment recommendations. So students who did well were able to identify the nursing role in ensuring that their intervention was successful. So they provided evidence of why those interventions work, but they also discussed potential barriers to success that nurses need to consider and overcome when carrying out the intervention. Students who didn't do quite so well tended to miss some of these steps. So they described the rationale for the intervention, which was great, and the intended outcome, but not the chronic care nursing considerations. So for example, something like patient education, which was discussed quite a lot across the board. So everyone who discussed education as an intervention identified why education is important, because people need to know what's making them sick. And they also identified the outcomes of education. So for example, patients will understand the impact of their unhealthy diet, or they will increase their physical activity, things like that. But what was missing in some essays was that critical discussion of the nursing role. So what do nurses need to do to make sure that education is actually what's needed, that it's targeted, that it's understood, that it's acted on, and that people have the resources they need to be successful in that change of lifestyle or whatever it was in the long term. That's the nursing role. And the reason why this is really important is because in the example of education, many people actually already know when their lifestyle choices aren't great, and most have some idea about what they ought to do about it. So as specialist chronic care nurses, we need to be thinking about what we do that goes above and beyond just telling people what they ought to be doing. So similarly with something like monitoring, most general level registered nurses know how to do things like monitor blood glucose level, screen for things like pressure areas, or make a referral to a multidisciplinary team member. That's fine. But we need to be thinking bigger and thinking critically about the role of a chronic care nurse. I want to read about interventions that support long-term, sustainable self-management and long-term engagement with healthcare services to improve health. That's the expertise that a graduate, qualified chronic care nursing practitioner needs to be able to demonstrate. In this intervention, be very careful that you don't describe a tool as opposed to an intervention. So a tool is something that we might use to facilitate an intervention. So for example, some essays gave a detailed description about a tool to help with monitoring and assessment, like a screening tool, so like something for depression or cancer screening, which are all really, really important tools. But think of the analogy of a hammer. A hammer is a tool, you use it to help build a table, but the hammer itself is not the intervention, it's the tool. And actually, the table is not the intervention, it's the outcome of the intervention. And the rationale behind why you need a table, because you need something to eat off, that's not the intervention either, that's the rationale. And all of these things are really important to discuss, but the nursing intervention is the process of building the table. That's what was missing in a number of essays. I hope that analogy makes sense. In terms of writing and the way we write, please try and avoid stereotyping and generalising people. Throughout a number of essays, I read statements implying things like that all people from lower socioeconomic areas have poor health literacy, that all Indigenous people live in remote areas, that everyone living with diabetes makes poor lifestyle choices. These are generalisations, and frankly, they're quite disrespectful. Please carefully craft your statements about people and about population groups to reflect the evidence and cite the evidence. So, for example, a sentence like, people experiencing social disadvantage may face barriers accessing health information and services for these reasons, X, Y, Z, and then reference it. That's a reasonable statement. Some essays flowed really, really well from concept to concept, and others jumped around all over the place. So anyone who received feedback about needing to work on the flow or structure of their writing, I recommend checking out the Studiosity tab on Blackboard. This is a new service for postgrad nursing students for this semester. And it's an opportunity to get fast feedback on your writing for free. Now, it may not be offered. In fact, I don't think it will be offered to us in subsequent semesters. So please get onto it now. Use it now while you can. In terms of referencing, referencing was generally done pretty well across the board. But please check SiteRight, because if you got comments about your referencing, all the information that you need to know is there. For an evidence review, there were still plenty of statements that did not have any reference to evidence. And it was really important that as a reader and a marker, we could see the evidence shine through. If you find, however, that you have maybe 2, 3, 4, 5 statements that all come from the same source and they're all written one after the other, this might be a warning flag that your writing is becoming a little bit too descriptive. And what that means is that you're reading something on a page and then you're regurgitating the same information onto your page. And what that shows is that you can mirror what you've read, which is great. But what it doesn't demonstrate is that critical reflection and your own understanding and interpretation of that information and how it applies to the issues you're discussing. So that critical reflection is what really shows the marker that you actually understand what you've read, because you can see more than one side of it and you can apply it. So at postgraduate level, it's really important to demonstrate your expertise and your ability to think critically about a topic. So one way to do that is using examples of how a concept might be applied in practice or in a different scenario. And that's a really good way to demonstrate that you understand, your understanding goes beyond simply repeating or describing someone else's words. Same thing for complex terminology. Never assume that the person reading your work will know what every complex medical term means. Anyone can copy complex medical terminology out of a textbook onto another page, but only an expert can translate it for everyone to understand. So as academic writers, this is our job. It's not up to the reader to have to go look things up so that they can make sense of what you've written. That's up to the writer to do. So overall, hopefully most of this feedback is pretty easy to address. Thank you again for working so hard on the assessment. I learned a lot from reading what you wrote, and I'm really looking forward to reading more in assessment 2. Our next seminar is on Tuesday the 6th of October. I'd encourage you to come along if you can at all. It's online. You can ask questions about assessment 2. In the meantime, you're very welcome to post questions on the Padlet or email me. But until then, I'll see you on the 6th. So take care, everyone, and thank you.